We are live. Thank you so much for the people that show up tonight, and thank you so much for the people that are online. And for streaming, thank you so much. I hope you guys stay dry and safe. I know there's a tropical storm passing by Georgia, so stay safe. Today we're going to be talking about balance. September is basically the Balance Awareness Month. We have been doing patient presentations for the past couple of months. And we're going to continue doing them for the next couple of months as well, so stay tuned. For the people that don't know me, I am Dr. Cassandra Jimenez. I am a lead clinician at Georgia Chiropractic Neurology Center. We have been helping patients since 1981, thanks to our founder and the clinic director, Dr. Mark Ellis. We are 7 doctors, 7 chiropractic neurologists. All of us have these different specialties, and we basically help people with neurological disorders like POTS, migraines, vestibular disorders like vertigo, dizziness, balance issues, migraines, and other functional disorders. A little bit about me. I am a licensed chiropractor in the state of Georgia and also in Puerto Rico. I graduated from Life University. I'm a diplomate of the American Chiropractic Neurology Board, and I also hold a fellow of the American Board of Vestibular Rehabilitation. I am currently an adjunct professor at Life University. I teach neurology classes, and also I teach technique and motion palpation. I'm also a contributor author for the Concussion discussion book, and I also have different case studies published in magazines from the Georgia Chiropractic Association. So today we're going to be talking about balance. We need to know what balance is. So balance is the body's ability to maintain the center of mass into the base. So we as human beings are able to go through life and maintain postural control and also maintain body's position. It doesn't matter if we're moving or if we're still. We are able to navigate through the different environments against gravity and not fall because of balance. So we are able to, for example, go to the beach and walk around the sand, or we're able to go to busy environments like the shopping or the mall, or also go to the grocery store where there's a lot going on and not fall or not feeling like unsteady. We also are able to do sport-related tasks like paddleboard, or we're able to do pickleball or play golf or tennis, just all of that thanks to balance. Balance disorders are the 9th most common reason that patients seek medical care, PCPs, result in 2 million office visits annually. So we basically see patients with balance disorders every day of our lives. It's something that is very common in our clinic, and hopefully after this talk, most people are going to be able to come to the clinic and seek help for balance disorders. Balance and quality of life. When a patient comes to my office or in the first visit, the first question that I ask is always like, why are you here? What if I have a magic wand, what is the number one thing that you would like us to help you with? Some people are not able to be in front of a computer because they get dizzy, so they're not able to work. I had a patient that she was in marketing and she was not able to work because of the dizziness. Some people are not able to play golf or tennis, or they're not able to play pickleball because of the dizziness. Some people are not able to just do what they love or take care of their children, or maybe go to a restaurant or socializing because of the different environmental that the environment affects them, and they get dizzy or they get disoriented. So that is the number one thing. Sometimes when people have these problems in their life, this tends to affect life, social interactions. It affects their professional activity, sometimes their self-esteem. They start having anxiety, depression, and it worsens their quality of life. So our number one goal in Georgia Chiropractic Neurology Centers, it will always be to always try to improve their patient's quality of life. Why do we use balance? So we use balance in every single task of our life. Number one thing is always safety. We're able to manage ourselves through life without falling because of balance. We use balance when we are climbing stairs, when we are running on a bicycle, when we are playing sports. Again, let's say we want to do yoga, or we want to do gymnastics, or some people want to do, again, paddleboard. We use our balance. We use balance for posture. So we are chiropractors, but in a regular chiropractic office, most of the people come complaining with low back pain, neck pain. What we don't know is sometimes if our posture is affected because of balance disorders, we can tend to have problems with neck pain and low back pain. We can also talk about Parkinson's. We see patients with Parkinson's. What happens with them sometimes, or most of the time, is the center of pressure shift backwards, which causes the a compensation of posture to come forward, and that causes a lot of problems with balance, coordination, sometimes like shoulder pain, low back pain. And here in our office, we try to work with balance issues specifically for Parkinson's, or just change posture to decrease chronic pains like neck pain or low back pain. Daily task. So I am from Puerto Rico. We always have that can of beans in the top corner of the cabinet. Everyone in Puerto Rico probably have like stepped into the table, and to reach into the top cabinet for that can, you need balance to do those things. You need balance to go to the kitchen, or you need balance to bend over to reach for clothes to put it into the washing machine. So those are daily tasks that we always do in our daily life that we need balance. One of the most important things that we don't talk a lot is cognition and balance. Most of my patients, and if you guys are streaming, you know that when we're doing balance rehab, I always have patients think about words that start with the letter P, or think about animals of the farm, or things like that, because we know that the connection between the brain and the mind also allowed us to know where we are in space. So now we are going to talk about what controls balance. We know that we have 5 senses. We have our vision, we have our inner ear, we have smell, taste, touch. But we also have other senses like what we call proprioception. What controls balance are 3 systems. First, we can see on the left is the information that comes from your ankles, from your joints, from your muscles. That is called proprioception. It tells you where you are in relationship to the environment. We also have, second, your vestibular system. Your vestibular system basically has different receptors that tells you if you're rotating, if you're tilting, if you're translating, and it's always on because we need to always, the brain needs to know always how you are against gravity. So your vestibular system is your second system that controls your balance, and your third system will be your vision. So your vision tells you where is the environment in relationship to you. So if you are walking and you don't want to bump into things, you're able to predict that there's a chair in front of you, and you're able to walk to the side. So the vision is the part of the brain that tells you, okay, what do I need to do as a human being to not bump into that area, or if there's too much going on, it allows you to respond with have muscle responses because it sends information into the different parts of your body to respond to it. So think about a symphony. So the vision, the proprioception, and your vestibular system are always sending information into your central nervous system to tell you where you are in space. So if at some point one of them it's not sending the appropriate information because it's not working as it should, then we develop a sensory mismatch and we start losing balance, which is what's happened a lot to our patients in our clinic. Symptoms associated with balance disorder. We see this a lot. Dizziness, we're going to start with that one. It's one of the most common that we see in our office. Dizziness is basically an umbrella. Most of the people come with dizziness, but we need to tell them, okay, how would you describe that dizziness? We need to ask that question all the time, because depending on how they describe the dizziness is what areas of the brain might be affected. For example, if a patient has vertigo, that might be related to a rotational. One of my patients, and if you are streaming, she always call it a washer machine. Other people describe it like lightheadedness or presyncope. These are the people that when they change positions, they feel that they're going to faint, or they have floaters. Sometimes this is caused by dysautonomia. Dysautonomia is an imbalance on your autonomic nervous system. So it's an imbalance between heart rate or blood pressure when we change position most of the time. And this can cause lightheadedness or presyncope. Patients with rocking sensations or floating. So this has become very, very, very common in the last couple of months after we started having more patients being diagnosed with PPPD. A lot of patients after COVID, they have been starting to experience rocking sensation or floating sensations when they are just steady, or when they're moving, or sometimes when they are in an environment that has a lot going on. We also have patients with unsteadiness or disequilibrium, which is another description of dizziness. Some people describe it as dizziness. Hearing loss, tinnitus, we see those symptoms associated sometimes with some condition that is called Meniere's. Nausea, vomiting, motion sickness. We have people with fatigue and disorientation. If the patient is, if your body is always trying to figure out where you are in space, you're just exceeding that capacity of your brain, and you start just utilizing energy more than you should, and you start feeling fatigue. Headaches, we see a lot of people with vestibular migraines that start having problems with balance disorders, or just having migraines during their day. And lastly, visual changes. We have blurry vision, double vision, that it also accompanies people with balance disorder. So which conditions do we usually see that have balance issues? And that's what we see mostly every day of our lives. We can divide them into vestibular disorders and other neurological disorders. Vestibular disorders, we can split them into two. We have the central vestibular disorders, and we have the peripheral vestibular disorders. In the peripheral vestibular disorders, we can talk about patients with BPPV. You probably have heard people with those crystals in the canals that when they lay on their back, they feel the washer machine, or they feel that they have vertigo. Most of the time that it's because of BPPV. In research, 57% of patients, most of the time, they complain of loss of balance. 53% of the time, they complain of vertigo. So most of the time, people know that they have BPPV because of vertigo, but according to research, most of the time, people complain of loss of balance. It's a pretty easy fix most of the time. So a lot of patients that are very prone to vestibular issues, they tend to also have BPPV at some time on their lives. I have experienced that with some of my patients. Like the other day, I have a patient that has PPPD. She went to take a massage, and after the massage, she stood up and she started having vertigo. She was not able to rotate her head to the right or fall back or lay on her back without having vertigo. And when we assessed her, she had a positive diagnostic testing, which is the Dix-Hallpike maneuver, and she tested positive for BPPV. It was a quick fix. We were able to do the maneuver that was according to the presentation, and it just took us maybe one maneuver to fix her. Other people complain of vestibular neuritis, which is the inflammation into the nerve. that can also cause vertigo and balance issues. Patients with Meniere's, we have talked about it, patients with tinnitus and hearing loss, and also they complain of balance. We have now patients, as I said, with PPPD. A lot of patients after COVID, they have been diagnosed with PPPD, with that sensation of feeling that they're floating or they're rocking all the time when they are standing. Tumors. We have a patient, she doesn't have what we call acoustic neuroma, but her tumor, it was mainly on one of the lobes of the brain, and it affected also her cerebellum. I have been taking care of her for a couple of years now, and she has always complained of balance. This week, she was able to do coordination exercises. She was able to go into do memory tasks with no issues. She was able to walk with not having any problems with, or not having to hold the mom's hand. So that was very nice to see. We also have acoustic neuromas, which is a tumor that is between the pons and the medulla. So that's another issue that can cause balance disorders. Other than the vestibular disorders, we have other neurological conditions. We talk about Parkinson, the shift of the center of pressure causing balance issues. We also have cardiovascular diseases like POTS. We're going to talk about postural orthostatic tachycardia syndrome and postural hypotension, which is differences in vitals, or let's say heart rate and blood pressure when they change positions. One is your heart rate jumps when you stand up. The other one is the blood pressure drops. And that can cause lightheadedness, that can cause unbalance, that can cause people to feel that they're going to faint. Concussions are very common in our office. We're going to talk in just a minute about the incidence, or how much people after concussions, they get dizziness and they have problems with balance. But if there are neuropathies, that can cause also balance issues. My mom, for example, she had neuropathy after getting chemotherapy, and she was not able to feel her feet, which caused her to, she almost had a car accident because she was not able to feel her feet, or she was bumping into things because she was not able to hold the balance appropriately. So this can cause also different problems with balance. We have vestibular migraines, motion sickness, and most not important too, the side effects of medications. It's very important for us to see the side effects of medications, because sometimes we have people, we are chiropractors, we see people with low back pain, neck pain. There are medications that can cause low back pain. We have also patients that have a lot of dizziness, vertigo. They are side effects of medications because they start having dizziness or they start having vertigo because of the medication. So it's something that we need to be aware, and we ask about them in our health history intake, just because we need to be aware of it. Concussions and balance. Dizziness and balance are very common, as I said. They are functional lesions. So basically, when you take an MRI or a CT scan, if you don't have a brain bleed, you're not going to see much on the MRI or the CT scan. Most of the times, what we need to do is we either do eye movement examination or balance testing to see what areas of the brain are affected. We know that with concussions, most of the time, the areas that are affected are the frontal lobe, the brainstem, and balance centers. And there's a lot of research that support that vestibular rehabilitation help people get back to having their normal balance, their normal reaction time, and etc. Also, we talk about POTS. For the people that don't know about POTS, very common also after COVID. There's even more and more people diagnosed with that condition. In between 1 million and 3 million Americans are being diagnosed with POTS. This is a disorder of the autonomic nervous system that can cause also, other than balance disorders, nausea, fatigue, lightheadedness. People feel like that they're sweating all the time, or they have sleep disorders, headaches. So it's very debilitating, and we have had really good results with it, but it's getting more common and common over time. Why people have problems with balance? There's different reasons why a patient with POTS can have them. One, we talk about it, it could be the autonomic nervous system not being regulated appropriately. We also have sensory integration issues or vestibular issues. Some people have POTS because they're not able to regulate appropriately the changes in against gravity, which who is the part of the brain that deals with that? The vestibular system. So those three aspects can cause the patient with POTS to have problems with balance. Long haulers. After COVID, after the pandemic, we have seen not only patient had flu-like symptoms or fevers, they also have neurological issues like loss of taste, loss of smell, but they also develop dizziness and balance disorders. They also complain of unsteadiness, postural instability, falls, trips. We see them very often, and again, it has become more often to see these people or this long hauler COVID over time. After we know the diagnosis, or we know what we take the history intake, we do our physical examination. It takes 3 hours. The reason why it takes 3 hours is because we need to pinpoint the areas of the brain that are not working appropriately, or they are causing the symptoms. So, for example, our physical examination, we start with the history intake form. It's pretty lengthy. We have the vital assessment. We talk about dysautonomia. So we need to check the vitals seated, laying, and standing to make sure that that's not the cause of the unsteadiness or the balance issues. We also do a concussion baseline. That's the way that we use the see-through logics to test for cognition. We assess the standard assessment of cognition. We assess processing speed, reaction time, to make sure that the different parts of the brain that controls those areas, they are working as they should. We test eye movements. Eye movements are the window into your brain. So that tells me what different subsections of the areas that can be affected. We test slow eye movements, fast eye movements, and the different pathways, we know them. And if one of the eye movements are not working as they should, then we take the puzzle and then we try to come up with like the hypothesis and then create a treatment plan. Balance testing, we're gonna go a little bit more in depth for it. And then we also do our comprehensive neurological examination. After we do all that, we know what parts of the brain are not working as they should, and then we go and create our treatment plan. The two diagnostic tests that we do are the CTSIB, or the Modified Clinical Test of Sensory Interaction and Balance, and the VNG, the Videonystagmography. The CTSIB is basically when you come, there's different platforms that functional neurologists use. We use the virtual reality, other people use other units, but we use a force plate and we check the center of pressure in different conditions. So, for example, if we see in the slide, for example, we have the three first conditions. The patient is on flat surface. First condition, the patient has eyes open. When you have your eyes open, you're utilizing the three system: your eyes, your inner ear, and your proprioceptive activity. So that is our standard. Second condition is flat surface, eyes closed. So when we close our eyes and we are on a flat surface, we're relying on two systems: the proprioceptive system and your inner ear. Third condition, we have eyes, we have the flat surface, but we have a distortion on your visual feedback. So patients that are visually dominant, sometimes they tend to have more sway and more balance issues. And these are the people that can handle go to shoppings or go to grocery stores because it's too much for their system. Then we do the same conditions but with a foam pad. So our fourth condition is foam pad with eyes open. When we use the foam pad, our proprioceptive system is unstable. So you're relying mainly into your visual system and your inner ear. When you close your eyes and you're with your foam pad, you don't have your vision, your proprioceptive system is unstable, so you're relying mainly on your inner ear. Then our last condition, which is the sixth condition, we have the foam pad, but we distort the visual feedback. And we analyze what happens with that patient when it's only relying in the visual aspect and your vestibular system. Here we can see Dr. Hose. As I explained before, the first on the left, she is with eyes open, flat surface. So she's using her 3 systems. Then I told her to close her eyes, and we're relying mainly on her proprioceptive system and the vestibular system. When I put her on the foam pad, she was with eyes open, and she was relying on her eyes and the vestibular system, not in the proprioceptive system because it was distorted. So the information that was coming from that, her ankles and her muscles, were not appropriately. And lastly, the vestibular, which is when we close the eyes and we put her on the foam pad. So she's mainly relying on the vestibular system. Depending on how the patient responds to different conditions, tells me what system I need to pay attention to. And it's different for everyone. I have a patient, this is one of the reports that I have from a couple of years ago. If you see on the bottom, I don't know if you're able to see it on the PowerPoint, but on the first 2 columns on the lower part, if you see NS, EO, that means that you are in a stable surface with eyes open. So if I go back, the first column, the patient was on standard, flat surface, eyes open on the first picture. What happened on that scenario? The patient was on the 3rd standard deviation, so she was below the average. She was with eyes open. On my second column, I told the patient to close the eyes. So on the second column, the patient was with eyes closed with flat surface. What happened to that patient, if I go back to the PowerPoint, she got better when she took away her visual system. Then I told the patient, let's put you on a foam pad with eyes open, which it was testing mainly her vision system. And if we see the 3rd column where the patient was with eyes open with foam pad, she then decreased into the 3rd standard deviation or less, so she was below the average. Again, when I told her to close the eyes, she got better. So the 2 times that I told the patient to close the eyes, her balance improved. So that told me that there was something going on with her visual system that was affecting the stability of that patient. After I know that information, I then go and watch my VNG, which is the next step. The VNG is, we put some goggles on you. They have infrared cameras, and we see 2 areas. We see your vision, and we see how it's working your inner ear. When you are in dark, you're mostly relying on your vestibular system. And if there's any movement, then we're able to see what's happening. We also check for slow eye movements and fast eye movements. And we also check for gait stability, and some OPKs. For these patients, they both have problems with balance. After we did the VNG examination, we saw that these two patients have problems with their visual system. On the left, I'm going to play it. You're going to know that you're going to see that the patient is looking forward and suddenly her eyes cross over. So that's what we call a convergence spasm. This patient had migraines and problems with balance. This mostly affects some patients have anxiety when you have this. Some people have problems with depth perception. It depends on what is causing their convergence spasm. But imagine every time that a patient closes your eyes, this is the perception that a patient is having, so they can fall. On the right, we have our another patient. This patient was diagnosed with PPPD, which is a vestibular disorder. If you see this patient, you're going to see, I'm going to put my cursor. You're not able to see it, but you see that the eyes are drifting to the right and they're jumping left. Drifting right and then jumping left. Drifting right and then jumping left. That is telling me that there's an unbalance on the vestibular system. And that is only one piece of the puzzle. Then I need to do my full neurological examination to see if I'm right or if actually pairs up with my puzzle. So these are two findings that people can have when they have problems with balance. These are two findings that you can see when patients are on the VNG testing. After we're done with the history intake, we know what symptoms you have. We did your diagnostic testing. We then come up with your treatment. Not two people have the same treatments, and that is what makes us different. So it doesn't matter that you have Meniere's, I have 3 patients with vestibular hypofunction on the right, or if I have 3 patients with concussions, I have 5 patients with POTS, I have 3 patients with VeDA, not one of them are going to have the same treatment plan because all of us are super different and they all can have problems with balance because of a different issue. So we do a lot what we call vestibular rehabilitation. And we talk about vestibular as the system that tells you where you are in space, and it also sees the environment around you. All the systems integrate into that vestibular system. So we can do balance training. We talk about cognition, so we can do cognitive exercises, eye movement exercises. We can do visual therapy, coordination exercises. We talk about adjustments where chiropractors, we can use adjustments as a part of the vestibular rehab if we adjust the area of the spine or the body that it's appropriate to stimulate, let's say, your right cerebellum or your vestibular system. We do a lot soft tissue work, and we also do physical therapy or modalities. So we don't just do one treatment, we integrate different treatments to target the area of the brain that we diagnosed that was the area that was not working appropriately. On the right side, you can see different images. So for example, on the top left, you're seeing Dr. Ho's doing balance training. So she's doing limits of stability where she needs to shift the center of pressure to get into a target and stay there. We also use that machine to do eye-head coordination exercises. Sometimes we use it for stroke patients so they can reach eye-hand coordination. We can do also weight shifting. So we use that machine a lot on our treatments. On the top right, you see she is wearing a headband with a laser. That's part of the vestibular rehab. That improves eye-head coordination. She's also on a foam pad, so we're working with balance at the same time. On the down left, you can see she is on TV. So that is our neurosensory integrator. We are doing cognitive exercises at the same time that she is balancing on a Bosu ball, also to increase balance and cognition. And on the right, down right, we're doing eye movement exercises with balance. So sometimes we do balance on flat surface, neutral position, tandem stance when it's like one leg in front of the other one. We also do it on the foam pad. It depends on the patient. Or sometimes we progress from seated to standing. So Dr. Ellis next month is going to be talking about treatment modalities and what do we do different as chiropractic neurologists. So I will definitely recommend to see that presentation as well, because it will be very helpful for you to understand what we do different as chiropractic neurologists. This is one of my case studies I wanted to share with you. It's a patient that was diagnosed with Meniere's. She was a 59 years old female. She had tinnitus, fullness of the ear. She had balance issues and vertigo. Her main goal, and I said earlier that I always ask, what you want in life? What do you want to improve in your daily life? For her, it was very important to do bicycle with her husband, play pickleball, and exercise without having symptoms. After my physical examination, I noticed that she had a right vestibular hypofunction. We created a treatment plan specifically for her. We did cranial work for her tinnitus and fullness of the ear. We did vestibular rehabilitation that we included coordination exercises, figure 8 movements, balance training, eye movement exercises to target that area of the brain that we wanted to target. And we saw her twice a week for 10 weeks. After finishing the full session, we did a reassessment and she reported a complete resolution of symptoms. Right now, she comes once a quarter just for a checkup, And sometimes she comes, if she feels that something is going on, she comes just for a tune-up or for me to change her hair at home exercises. It's not a case that happens to everyone. This is a very good case that we were able to help. We have other people that we have had with vestibular migraines. On the right, you can see our book, the book that we contributed. We have a chapter that is a case study of a patient that had a concussion, that he was experiencing vertigo, he was experiencing headaches, and after doing a round of vestibular rehab, he was able to go back to actually riding a bike too. If you're interested in the book, it has a lot of different topics that they discussed. We have them in our office. You can reach out or we can guide you where to find them. And the most important thing is why balance is important in our life. Now people don't last 65 years, 75 years like before. Now we're able to live 90, 100 years, and hopefully we're able to last longer. Now people don't die because of heart conditions. People die mainly because of dementias. But we also have seen that a lot of people now, when you're older or when you are elderly, that means more than 65 years old, patients tend to have a lot of prevalence to falls. So falls are a leading cause of morbidity among the elderly. Most common cause of non-fatal injuries. What causes problems with balance? What happens? Sometimes they have fractures. Sometimes they have limitations of mobility. My grandma, she had Alzheimer's. She didn't die. She was in the 80s. She didn't die because of Alzheimer's. She died because she fell, and then she had a fracture, and then she had the fistula was affected, and then she died days later. So it's very common, and if we can help those people, since everyone should be getting brain rehab, because the brain is constantly changing. So when you're a kid, when you're an adolescent, when you're a teenager, when you are in college, when you are older, the brain is always changing. We can help you optimize your brain. We can also help you being more self-sufficient. We have patients right now. One of our patients she's in the 75 years old, and she travels the world with her husband. But she has a lot of trouble with balance, so we have been working with her to help her get into that. I want to be able to go and do exercise or travel the world when I'm 80, when I'm 85. Life doesn't stop when we're 65. So our goal is to get more people to be more self-sufficient. If people can start having brain rehabs when they're younger, then I believe it will be better for when we're older. Fall-related injuries among the elderly are cause of nearly 750,000 hospitalizations and 25,000 deaths per year in the United States. Preventing falls, it's possible. It can be multifactorial, and we know about it, but there's research that it says that if you're able to have combined muscle strengthening, balance training, and endurance training for a minimum of 12 weeks, according to that research, you're able to help those patients regain the balance and have a little bit of more quality of life, which is the end goal. And then that will be my presentation for today. Thank you so much. If you guys have any questions, you can write them, or if you have any questions on our audience, you're more than welcome to ask.